I'm going to palpate the trapezius muscle, which is a very large and superficial back muscle. So I'm going to separate it into its three parts. So it's going to be the upper trapezius, the middle trapezius, and the lower trapezius. So we'll start with the upper traps. So upper trapezius, its most superior attachment is going to be the occiput, or the external occipital protuberance. So how I'm going to find that, it's the boniest, bumpiest part of the back of the head. So I'm going to do a flat hand palpation here, and I'm going to find this little bump. And once I find it, I can travel slightly laterally, and that is the superior nuchal line, and that is also one of the superior attachments. Now the upper traps attaches into the nuchal ligament as well, which travels down the spinous processes of the cervical spine. So that's a soft tissue attachment. And then it ends up by attaching at C7, which is the most prominent cervical vertebrae. So how I'm going to find that is I'm going to do a flat hand palpation here. I feel right here is the most prominent spinous process. So I'm going to basically just put my fingertips on top of these three, and I'm going to passively rotate my client's head back and forth. I can feel that this guy is moving a lot and the one below isn't. So that's going to be my C7 spinous process. Okay, because the thoracic spinous process is going to be attached, this vertebrae is attached to ribs, so it's not going to move as much when I rotate the head. Now, the upper fibers of the traps come laterally, and they are going to attach onto the spine of the scapula. On the anterior side, the lateral third of the clavicle, and all the way out here to the tip of the shoulder, called the acromion process. Okay, so to find the acromion, again, just press into the soft tissue with a flat hand. And you're gonna feel soft tissue and muscle, and then suddenly you're gonna come up against a bone. So right there is gonna be a acromion process. Flat hand against the posterior shoulder, you're going to find a long ridge here, and so you can roll your hand back and forth across it. That is the spine of the scapula. And from the front, dipping towards the front, the first bony attachment you come across is going to be the clavicle, and it's sort of the counterpart to the spine of the scapula. It feels almost the same, just a long bony ridge on the anterior side. So in terms of the actions of the upper traps, it's going to do a lot of different things. So the main action is going to be the elevation of the scapula itself. So elevation of the scapula, it also does upward rotation of the scapula. It also assists in retraction of the scapula, so pulling the shoulder blades together. Upper traps acts on the neck as well. It's going to do extension of the head and neck. So if my client lifts her head up, perfect. You can see a lot of muscles pop up in there. Okay, and I can feel all this pop up. Thank you, relax. It also does lateral flexion to the same side, so just press against me there. Perfect. You can see this ridge pop up. And then it also, we're not going to do this action, but it also rotates the head ipsilaterally, so to the same side. So I'm going to activate the right upper traps by having her look to the right. You don't have to do that right now. Okay. The way I really like to activate upper traps, though, is by a shoulder shrug. Okay. So I'm just going to depress her shoulder a little bit, and I'm going to have her push into my resistance there. And there it is. I can feel it completely activate here. All the fibers, again, they're very superficial. All of them from that spine of the scap all the way up to that superior nuchal line. And that's the upper traps. Now I'm going to do the middle fibers of the trapezius, or the mid traps as they're called. So this section is going to start at the spinous process of C7, sort of where we left off from the upper traps, and it's going to come down to T4 spinous process. And these fibers are very horizontal. Okay, they're superficial to the rhomboids, which do a very similar action of retraction of the shoulder blades, the scapulas. So these ones we know by fiber, by the feeling of the fibers, which one we're on. So we're going to go C7 here. We're going to find, again, C7 is the most prominent cervical spinous process. So I think it's right here. So I'm going to put my finger on what I think is C7 and one on T1. And I'm going to passively rotate my client's head back and forth. C7 moves a lot, T1 does not. So I am on C7 here. So let's just count it down. So there's C7, there is T1, T2, T3, T4. So that is your mid-traps attachment. Okay. And these guys are going to scoop over this way, and they're going to attach to the lateral aspect of the spine of the scapula. So to find the spine of the scapula, I place my flat hands just flat onto that scapula, and I roll back and forth, feeling for this long bony ridge, which is right here. And it culminates at the acromion. So I know this lateral part of it is going to be that mid-traps attachment. So the main action of mid-traps is retraction. So what I'm actually just going to do is, same as my rhomboids palpation, I'm going to just have you retract your shoulder blades, like pull them back together. Perfect. And we feel right. I was keeping my hand on the spine of the scap, so I'm just going to find my way all the way over to the spinous processes again, and I feel those fibers running perfectly horizontally. Thank you. And I know that's the mid-trapezius. For the final piece of the trapezius muscle, we're going to do the lower fibers of the traps. So they are going to attach from where the middle fibers left off, so T5 through to T12, okay? And the way to find that, I like to just find the inferior, put my hands around the scaps here, and I find that inferior angle of the scapulas, and then I draw a line between them. Now this should be approximately T7. Some literature says T8, so we're going to say it's T7. I'm going to go up 2. So there's T7, there's T6, and there's T5. So we'll say it starts here, spinous process of T5, and it goes down 5, 6, 7, 8, 9, 10, 11, 12. Okay, so there is the thoracic attachment of the lower fibrous traps. And then these fibers are going to sweep sort of upwards, and they are going to attach laterally to, again, the spine of the scapula. But the middle fibers of traps, they attach to the lateral half of the spine of the scap. The lower fibers of traps, they're going to attach to the medial part of the spine of the scapula. So again, I'm going to take my flat hands, place them on the scapula, and just kind of roll back and forth, and I will feel that long bony ridge that is the spine of the scapula. And I'll palpate that medially until it drops off into soft tissue here. So that's the end of the scapula. That's the medial border of the scapula. So I know that this medial part of the spine of the scap is that lower fibrous traps attachment. So it's a long oblique piece here going from inferior up superior and lateral. So in terms of the action, my favorite action to activate lower fibrous traps is actually a superhuman movement. Which basically combines depression of the scapula, retraction of the scapula, and that upward rotation of the scapula. So what I'm going to do is I'll have my client bring her arms just up like this and just lift them up like Superman for me. Perfect. And there, I can feel it coming from here all the way down here. This movement does activate mid-traps as well. Thank you. But that's the best way to do the lower trapezius.